welcome to my channel Lazy Fellows. I am your pharmabahen. Hello guys, in the series of completing JNTU overview of syllabus copies, now let's continue with the M.Pharmacy Pharmacological department. In this we have, in the first semester we have advanced pharmacology, clinical pharmacology and pharmacotherapeutics, pharmacokinetics, drug metabolism, research, pharmacovigilance, principles of drug discovery, animal cell cultures and applications, molecular biology, principles of toxicology, research methodology IPR, advanced pharmacology lab, and clinical pharmacology and pharmacotherapeutics lab. And for the second semester, we have advanced pharmacology 2, pharmacological screening methods, toxicology, and elective subject, quality use of medicines, pharmacoepidemiology, pharmacoeconomics, and advanced drug delivery system, pharmaceutical management, nutraceuticals, pharmacokinetics, therapeutic drug monitoring, advanced lab 2, and then pharmacological screening methods, toxicology lab 4. And in the second year we have elective subjects like biostatistics, hospital and community pharmacy, plant medicinal plant biotechnology. And the semester 1 first subject is advanced pharmacology. In this we have general pharmacology, pharmacokinetics, neurotransmission, central nervous system and pharmacology, cardiovascular pharmacology, autocoid pharmacology. The next subject we have clinical pharmacology and pharmacotherapeutics. In this unit 1, principles of pharmacokinetics, adverse react, pathophysiology of various drugs and drug therapy. And the next subject is pharmacokinetics and drug metabolism. In this we have drug absorption, drug distribution, elimination of drugs, bioavailability of drug products, pharmacogenetics. And then we have a clinical research and pharmacovigilance. In this, regulatory perspectives of clinical trials, clinical trials types and design, clinical trial documentation, basic aspects, terminologies and establishments of pharmacovigilance, methods, ADR reporting and tools used in pharmacovigilance. And the next subject is principles of drug discovery, overview of modern drug discovery. We have already completed almost up to the target validation. Please go and watch the videos. Then lead identification, rational drug design, molecular docking, QSAR statistical method. Now coming to animal cell culture. In this we have introduction to animal biotechnology and its applications, basic tissue and cell culture, feeder layers and substrates, gas phase tissue culture, cultured cells, in vitro fertilization, transgenic animals, in vitro fertilization in humans, molecular biology. In this we have introduction to molecular biology, nucleic acids, DNA structure, DNA topology, organizations of DNA in chromosomes, mutations, DNA protein interactions, DNA replications, transcription, translation, synthesis and process of proteome, regulations of gene expression in prokaryotics and eukaryotics. Then we have principles of toxicology, introduction to general toxicology, toxicology of liver, neurotoxicology, toxicology of intestine and nanotoxicology and ectotoxicology. Then we have research methodology, meaning of research problem, effective research studies approach, effective technical writing, nature of intellectual properties as patent rights. And advanced pharmacology lab, these are the lab experiments. Next we have a clinical pharmacology and pharmacotherapeutics lab 2. In semester 2 we have advanced pharmacology 2. In this, endocrine pharmacology, chemotherapy, drugs in it, and chemotherapy 2, some other drugs are introduced, GIT pharmacology, free radical pharmacology. Then we have pharmacological screening methods, toxicology, laboratory animals, preclinical screening of new substances, pharmacological activity, in vivo, in vitro, and other possible animal alternative methods. Preclinical screening of new methods. Preclinical screening of new substances for pharmacological activity using in vivo, in vitro of some other models. Different categories of drugs given. Toxicology. Then we have quality use of medicines. Introduction to quality use of medicines. Concepts of quality use of medicines. Different categories of various settings. Regulatory aspects of QAM, QUM in India. Regulatory aspects of quality use of medicines. Medication. Pharmacoepidemiology and pharmacoeconomics. In this we have introduction to pharmacoepidemiology, pharmacoepidemiology methods, introduction to pharmacoeconomics, pharmacoeconomic valuations, definitions and steps involved in application and the disadvantages, advantages of the following. All this. And then we have drug delivery systems in the semester 2, that is fundamental controlled drug delivery systems, design, fabrication, evaluation, applications of following systems, biochemical molecular biology approaches. Biochemical molecular biology approaches in the drug liposomes, neosomes, microsomes, and targeting particular organ, drug delivery to lungs, delivery to brain and neoplasms. And then we have pharmaceutical management. Pharmaceutical management, their meaning and administration and human relationship approach, fundamental concepts of production, financial, personal, legal, marketing functions with special reference to pharmaceutical management, understanding organizations, personal management, management of industrial relations. Then we have nutraceuticals. In this, we have definitions of functional foods, nutraceuticals, dietary supplements, phytochemical nutraceuticals, all these things. Introduction to free radical, measurements of free radicals in diabetes, mellitus, antioxidants, synthetic oxidants, food laws and regulations and claims. Pharmacokinetic therapeutic drug monitoring. Unit 1 we have pharmacokinetics, therapeutic drug monitoring, drug selection, dosage regimen and design, pharmacokinetics of drugs, patient compliance, analytical aspects of TDM, uses of HPLC, TDM, selected individual drugs. Advanced pharmacology 2, these are the experiments. Then we have pharmacological screening methods, toxicology lab 4. Then the second year we have biostatistics, introduction to scope of biostatistics, measure of central tendency, measure of dispersion, probability, rules, ANOVA, hypothesis in testing, non-parametric testing. Hospital community pharmacy, in this introduction to hospitals, hospital formulary, guidelines and development, education and training, community pharmacy practice, community pharmacy management, prescriptions. Then we have medicinal plant biotechnology, in this introduction to plant biology, plant biotechnology, different tissues, cultures, techniques, immobilization techniques, biotransformation and transgenesis, secondary metabolism in tissue culture with emphasis on production of medicinal agents. Then we have research paper,